My name is Pete Grossi. I'm 57 years old. I was the first open heart surgery patient for Silver Cross Hospital. When I was 8 years old, I was diagnosed with high blood pressure. I've been on medication ever since. Throughout the rest of my time, my entire childhood and everything, I've always been on multiple blood pressure pills throughout my life. Come October 3rd, 2015, I had a heart attack. Monday morning, I was rushed here to Silver Cross Hospital, and long story short, the surgeon on call told me another 15 minutes he couldn't have done nothing for me. So Silver Cross did save my life at that time. So when it came down to my couple years after that, I've done all my heart tests that I do every year with Dr. Joe Stella, and I wound up failing my tests in 2019. So I went in for an angiogram with Dr. Joe Stella, needed a double bypass. Silver Cross asked if I wanted to be the first open heart patient. Right away I said no. I thought about it and then I said yes. So I came in and wound up needed a quadruple bypass. When I originally said no, I thought I didn't want to be the first one, just as you think, but then I kind of started thinking about it, and Silver Cross saved my life in 2015, a few years before, so I thought there's just no question with the team here, and then with it being a brand new section at the time, I just made up my mind that there was nowhere else to go. So then the day of, I come in here on May 21st of 2019 was the first open heart surgery, and I was really just scared to death. But I could not have been happier with every person that was part of this whole surgery, care, the floor, the heart care floor, everybody. It was just, there's not one bad thing to say about anybody here.
For years, Silver Cross Hospital has had one of the busiest heart programs in Illinois. In fact, in 2018, our cardiac catheterization lab was ranked the 8th largest in the entire state. But we were missing some key components, namely open heart surgery and a structural heart care program. So in line with our mission of meeting the healthcare needs of our community, we decided to expand and advance our cardiac services and develop a new facility to meet the community need. So in 2019, with the permission of the state of Illinois and in partnership with Cardiothoracic and Vascular Surgical Associates, led by Dr. Pat Pappas, we started an open heart program. To date, we performed more than 300 procedures, and I'm pleased to report that the outcomes have been outstanding. And thanks to the planning, dedication, and generosity of so many people, today we officially open our 33,000 square foot cardiac surgery and procedural facility, which includes 2 high-tech operating rooms and a hybrid room for minimally invasive structural heart cases, which I'm sitting in right now. All this magnificent equipment will be used for cardiac catheterization cases, and this room can be immediately converted to a full-scale operating room if the need arises. The minimally invasive program will be led by Dr. Ravi Ramana, and he, along with many other interventional cardiologists here at Silver, have developed the program and are ready to serve the community.
Patients with severe aortic stenosis are often seen by our heart team. These patients often have symptoms of shortness of breath, chest pain, or passing out spells. Based on other testing, we can determine how severe this valve disease is. Patients with severe aortic stenosis are candidates to getting this valve fixed. Traditionally, that's been done with open heart surgery. Heart surgeons open the chest, take out the old valve, and sew in a new one. This has been a great procedure through the years, but more recently, over 20 years worldwide and almost a decade in the United States, we have been performing transcatheter aortic valve replacement, or TAVR. During this procedure, instead of opening the chest, we make a small incision in the leg. We use our equipment under X-ray guidance to get up into the patient's heart. We use a balloon to inflate and push aside the old diseased valve and implant the new valve, a metal ring with a small tissue valve inside it. This avoids the need for open heart surgery and the need for the patient to be on the heart-lung machine. Patients that are referred to our team to be evaluated for aortic stenosis are seen by cardiologists as well as heart surgeons. As you can imagine, when the option is given between open heart surgery and a less invasive method, most patients want TAVR. But we only offer TAVR to patients that we think will be good candidates. Although it's a less invasive form of therapy, we want to make sure that we can be safe and effective both short and long term. This is done by other testing, including CAT scans, angiograms, and ultrasounds. Patients in the past typically have been older patients with average ages close to 90 years old. But over the last decade, as technology has improved and our experiences increased, we've treated younger and younger patients. So patients typically over the age of 60 with severe aortic stenosis are reasonable to be considered for both TAVR or open heart surgery by our team. It's an exciting time at Silver Cross Hospital. We're excited as a team to bring transcatheter aortic valve replacement procedure to this institution. The team here is highly experienced in performing TAVR, as we've been performing TAVR for over 9 years at other Chicago locations, performing as a team over 1,000 TAVRs.
Hi, my name is State Senator Mike Hastings. Heart disease is the leading cause of death in the United States for both men and women. According to the Centers for Disease Control and Prevention, about half of all Americans have at least one of 3 main risk factors for heart disease: high blood pressure, high cholesterol, or smoking. It's likely that you or someone you know will need heart care in the future. Closer to home, the statistics are equally alarming. The most recent Will County Community Needs Assessment stated that heart disease is the top cause of death in Will County and the second cause of hospitalization. That's why Silver Cross made a bold and innovative plan to ensure that patients requiring open heart or structural heart surgery can have all their care under the guidance of their primary physician and cardiologist in the community where they live through their new $22 million cardiac expansion unit. Silver Cross has brought together an elite team of cardiologists and surgeons available immediately to provide our neighbors the highest quality of cardiac care, including open heart surgery, minimally invasive valve repair and replacement, and more. With the best medical technology and clinical expertise, patients can undergo these innovative surgical procedures close to home and in a hospital they trust. Silver Cross. Stay healthy, Will County, and everybody out there, and God bless you and your families.
Hi, I'm Tim Balderman, the mayor of the Village of New Lenox, and I want to welcome all of you as we congratulate Silver Cross on the opening of their new cardiac unit. I want to say a special thank you to all of those volunteers and everyone that's pitched in to help make this come to fruition. As the mayor of New Lenox, we've seen firsthand how Silver Cross partners with the very best to bring quality health care to everybody in the region. Recently, having received a pacemaker myself, I know how important cardiac care is. Here in New Lenox and in the region, we have seen so many partnerships with Silver Cross that have helped bring that quality health care to each and every one of us so we don't have to travel very far, so our families can be close to those that are hospitalized. Heart disease is the leading cause of death in the United States, and that's included right here in Will County as well. So having this cardiac unit is something that's very special and something that's desperately needed. Again, congratulations to Ruth Colby, to the Silver Cross Board, to all the doctors and all the staff, and all of you who made this possible. We're excited that the cardiac unit will be up and running and serving those in the region. Thank you.
I'm Mark Stevens.
And I'm Susan Prock, and we're the co-chairs for the Campaign for Heart Care at Silver Cross Hospital.
And today we're here to inform you that we're almost at our goal of $2 million on a total project cost of $22 million. So we need a little bit of help here to get across the finish line.
We've had more than 1,000 individuals, patients, employees, physicians, local businesses, and others contribute to this campaign. We're so very grateful for their support and allows us to bring this sophisticated and advanced care to our local hospital.
My wife and I have personally supported the campaign along with my business here in New Lenox. So we're hoping we can count on you to help us get across the finish line.
We are so proud to have this level of service here at our community hospital. We have one of the best hospitals in the country, a top 100 hospital that we should all be very proud of. And we're so very happy that those that we know and love that need cardiac care can have that physician care and high level of service delivered right here in our local community, close to home, with physicians that they trust.
It's very important to us and all of us here at Silver Cross that when someone needs the heart care here at Silver Cross, they can stay here. They don't have to travel to far distant places to get the services they need for the heart care they need right here in Will County. We really need your help, so please step up as soon as you can. Thank you.
Thank you.
It's just a great feeling to actually come here and have this. It's kind of like, it's kind of like my hospital. With the expansion to Silver Cross, I believe it's more of a peace of mind to me that Silver Cross is right here to help and it's close by. And I think it's a fantastic